AMT-RMA Exam Review. Question 1. At a preventive care appointment, a patient has no known infection listed in the chart. Which infection control approach still applies? Option A. Use standard precautions for every patient encounter. Option B. Use airborne isolation for every routine visit. Option C. Wear sterile gloves for all administrative tasks. Option D. Skip hand hygiene when the patient appears healthy. The correct answer is option A. Use standard precautions for every patient encounter. Standard precautions assume that blood and body fluids may be infectious and apply to every patient. Appearance alone is not a safety guide, while universal airborne isolation or sterile gloves for non-sterile tasks is unnecessary and inefficient. Question 2. While following clinic policy, the medical assistant notes that the medical assistant's hands are visibly soiled after cleaning a spill while following standard precautions. Which method is preferred? Option A. Wash with soap and water. Option B. Put on a second pair of gloves over the soil. Option C. Use hand sanitizer only. Option D. Wipe hands on a paper towel. The correct answer is option A. Wash with soap and water. Soap and water are preferred when hands are visibly soiled because mechanical washing removes material. Sanitizer alone, wiping without washing, or covering soil with gloves does not adequately clean the hands. Question 3. A medical assistant reviews a case where a medical assistant experiences a needle stick while cleaning a room for a patient in the exam room. Which action should be taken first? Option A. Apply lotion and continue rooming patients. Option B. Finish all remaining tasks before reporting. Option C. Wash the area and report the exposure according to policy. Option D. Hide the injury if bleeding stops. The correct answer is option C. Wash the area and report the exposure according to policy. Immediate washing and prompt reporting start the post-exposure process and protect the employee. Hiding the injury, delaying reporting, or simply applying lotion can interfere with timely evaluation and follow-up. Question 4. For a pediatric patient in an outpatient setting, a patient is suspected of having active tuberculosis. Which precaution is most appropriate? Option A. Use only clean gloves. Option B. Place the patient in the waiting room until closing. Option C. Ask the patient to remove any mask to speak clearly. Option D. Use airborne precautions with appropriate respiratory protection. The correct answer is option D. Use airborne precautions with appropriate respiratory protection. Tuberculosis can spread through airborne particles, so respiratory protection and isolation procedures are needed. Gloves alone, extended waiting room exposure, or removing source control can increase transmission risk. Question 5. When preparing safe patient care, a conscious diabetic patient is shaky and has a low glucose reading while following standard precautions. Which action is generally appropriate by protocol? Option A. Administer a random antibiotic. Option B. Give nothing and send the patient to drive home. Option C. Provide a fast-acting carbohydrate if allowed by office policy. Option D. Tell the patient to exercise vigorously. The correct answer is option C. Provide a fast-acting carbohydrate if allowed by office policy. A conscious patient with low glucose may need fast-acting carbohydrate according to protocol. Driving, antibiotics, or vigorous exercise can worsen the situation or fail to treat hypoglycemia. Question 6. After confirming the patient's identity, instruments are removed from the autoclave after a cycle for a patient scheduled for a procedure. Which finding supports that the sterilization process should be reviewed before use? Option A. The package is dry and intact. Option B. The chemical indicator has not changed as expected. Option C. The load has a completed log entry. Option D. The instrument pack is labeled with the date. The correct answer is option B. The chemical indicator has not changed as expected. A failed chemical indicator suggests the sterilization conditions may not have been met and the load should not be used until evaluated. Dry packaging, completed logs, and date labeling are expected quality control elements rather than failure signs. Question 7. While following clinic policy, the medical assistant notes that a disinfectant splashes onto the counter and the medical assistant needs spill guidance. Which resource gives chemical handling information? Option A. Safety data sheet. Option B. Growth chart. Option C. Insurance aging report. Option D. Appointment ledger. The correct answer is option A. Safety data sheet. A safety data sheet explains hazards, personal protective equipment, spill response, and first aid information for chemicals. Scheduling, billing, and growth records do not provide chemical safety instructions. Question 8. A medical assistant reviews a case where a small contained fire is being addressed with a fire extinguisher after alarm procedures during a quality control check. What does the first step in PASS mean? Option A, prepare billing forms. Option B, pull the pin. Option C, push the patient. Option D, pour water first. The correct answer is option B, pull the pin. PASS stands for pull, aim, squeeze, and sweep when using an extinguisher. The other choices are unrelated to extinguisher operation and may delay a safe response. Question 9. During a skills check, the scenario states that a patient reports a severe latex allergy before rooming for a new patient. Which action is appropriate? Option A, ignore the report unless a rash is visible. Option B, document the allergy only after the visit. Option C, use powdered latex gloves for a better fit. Option D, use latex-free supplies and alert the care team. The correct answer is option D, use latex-free supplies and alert the care team. Latex allergy can cause serious reactions, so latex-free supplies and team awareness are important before care begins. Ignoring the report, using latex products, or delaying documentation can expose the patient to harm. Question 10. A provider asks for assistance because a provider asks for an apical radial pulse comparison. Which method is appropriate? Option A. Have two staff members count apical and radial pulses at the same time. Option B. Subtract blood pressure from pulse rate. Option C. Use pulse oximetry only and skip manual counting. Option D. Count radial pulse in the morning and apical pulse later. The correct answer is option A. Have two staff members count apical and radial pulses at the same time. An apical radial comparison requires simultaneous counts so a pulse deficit can be identified accurately. Separate timing, unrelated calculations, or relying only on a device does not measure the difference between heartbeats and peripheral pulses. Question 11. A provider asks for assistance because an exam room is being disinfected between patients during a quality control check. Which workflow is most appropriate? Option A, start with the trash and then clean the clean supplies. Option B, clean from less contaminated areas toward more contaminated areas. Option C, disinfect only areas the patient mentions touching. Option D, use the same wipe until it is visibly dry and dirty. The correct answer is option B, clean from less contaminated areas toward more contaminated areas. Cleaning from cleaner to dirtier areas helps prevent spreading contamination back onto cleaner surfaces. Starting with trash, overusing wipes, or cleaning only reported contact points leaves avoidable contamination. Question 12. For a returning patient in an outpatient setting, a coagulation study such as patient or INR is ordered for a returning patient. Which tube is typically used? Option A, light blue sodium citrate tube. Option B, yellow acid citrate dextrose tube. Option C, lavender EDTA tube. Option D, gray sodium fluoride tube. The correct answer is option A, light blue sodium citrate tube. Light blue tubes contain sodium citrate and are commonly used for coagulation testing. EDTA, fluoride, and acid citrate dextrose tubes have different additives and are used for other laboratory purposes. Question 13. A medical assistant reviews a case where a fasting glucose specimen is being collected. Which tube additive is commonly associated with glucose preservation? Option A, sodium fluoride in a gray top tube. Option B, EDTA in a lavender tube. Option C, no additive in a culture bottle. Option D, sodium citrate in a light blue tube. The correct answer is option A, sodium fluoride in a gray top tube. Gray top tubes commonly contain fluoride to help preserve glucose by inhibiting glycolysis. EDTA, citrate, and culture bottles serve different testing purposes and are not the usual glucose-preserving choice. Question 14. During a clinical skills check, an adult patient is involved when a tourniquet has been applied while locating a vein during clinical workflow. Which practice helps prevent hemoconcentration? Option A, release the tourniquet within about 1 minute when possible. Option B, apply it over broken skin for grip. Option C, tighten it after blood begins flowing. Option D, leave it on until all paperwork is complete. The correct answer is option A. Release the tourniquet within about 1 minute when possible. Prolonged tourniquet application can concentrate blood components and affect results. Leaving it on too long, tightening it unnecessarily, or placing it over broken skin can harm the patient or compromise the specimen. Question 15. In a medical assistant certification review scenario, 2 patients are placed in the same appointment slot for an adult patient. What is this called? Option A, capillary puncture. Option B, double booking. Option C, closed filing. Option D, downcoding only. The correct answer is option B, double booking. Double booking schedules more than 1 patient in the same time slot and should be used carefully according to policy. Capillary puncture, filing, and downcoding are unrelated terms. Question 16. During a skills check, the scenario states that an additive tube has just filled during venipuncture. Which action is appropriate? Option A, open the tube and stir it with a swab. Option B, shake it hard until foam appears. Option C, invert the tube gently the recommended number of times. Option D, set it aside without mixing. The correct answer is option C. Invert the tube gently the recommended number of times. Additive tubes need gentle inversion to mix blood with the additive and prevent clotting or testing errors. Shaking, failing to mix, or opening tubes creates specimen problems and exposure risk. Question 17. A provider asks for assistance because a urine drug screen requires legal chain of custody handling after confirming office policy. Which action is essential? Option A, use a routine sticky note instead of required forms. Option B, document specimen control and signatures at each transfer. Option C, leave the specimen unlabeled in the bathroom. Option D, let the patient take the specimen home overnight. The correct answer is option B. Document specimen control and signatures at each transfer. Chain of custody documents who handled the specimen and helps preserve legal validity. Unlabeled storage, patient transport outside protocol, or informal notes break the required control process. Question 18. While reviewing office protocol, a new patient is involved when a clinic performs a rapid strep test classified as waived for a new patient. What does waived testing generally mean? Option A. The test is simple and has a low risk of erroneous results when performed correctly. Option B. The result cannot be documented in the chart. Option C. Only a physician may read the result in every setting. Option D. The test never needs quality control. The correct answer is option A. The test is simple and has a low risk of erroneous results when performed correctly. CLIA waived tests are considered simple with low risk when instructions are followed, but quality procedures still matter. Waived status does not remove documentation, training, or quality control responsibilities. Question 19. During a skills check, the scenario states that an employee is assigned to duties with potential blood exposure after the patient asks a follow-up question. Which training is required by safety standards? Option A, real estate licensing training. Option B, restaurant menu training. Option C, retail cashier training only. Option D, bloodborne pathogen training with exposure control procedures. The correct answer is option D, bloodborne pathogen training with exposure control procedures. Bloodborne pathogen training teaches exposure risks, protective practices, and post-exposure steps for healthcare workers. The other trainings do not address occupational exposure to blood or body fluids. Question 20. A provider asks for assistance because a finger stick specimen is being collected for a patient with a routine complaint. Which step is commonly performed after puncture? Option A, squeeze the finger forcefully until tissue fluid appears. Option B, bandage before collecting the specimen. Option C, touch the collection device to the skin surface repeatedly. Option D, wipe away the first drop of blood if required by the test procedure. The correct answer is option D, wipe away the first drop of blood if required by the test procedure. Many capillary procedures call for wiping the first drop because it may contain tissue fluid or contaminants. Excessive squeezing, scraping the skin, or bandaging before collection can compromise the specimen. Question 21. A medical assistant reviews a case where a tube label and requisition do not match while supporting safe patient care. Which action is most appropriate? Option A, send it to the lab without comment. Option B, scratch out the name and keep going. Option C, guess which name is correct. Option D. Stop processing and resolve the discrepancy according to policy. The correct answer is option D. Stop processing and resolve the discrepancy according to policy. Label and requisition mismatches create serious patient identification risk and must be resolved before processing. Guessing, altering labels casually, or sending the specimen without correction can produce dangerous errors. Question 22. After confirming the patient's identity, a point-of-care glucose test is about to be performed for a patient with a routine complaint. Which supply check is needed? Option A. Wet the strip before inserting it. Option B. Use any strip from an unlabeled container. Option C. Cut the strip in half to save supplies. Option D. Confirm the test strips are not expired and are stored correctly. The correct answer is option D. Confirm the test strips are not expired and are stored correctly. Expired or improperly stored strips may produce inaccurate glucose results. Unlabeled strips, wetting strips, or altering strip size violates testing procedure and quality standards. Question 23. A medical assistant reviews a case where a pelvic exam is being prepared. Which action supports patient comfort and privacy? Option A. Discuss private details loudly outside the room. Option B. Invite unrelated staff to observe. Option C. Leave the patient uncovered until the provider arrives. Option D. Provide appropriate draping and explain each step within the assistant's role. The correct answer is option D. Provide appropriate draping and explain each step within the assistant's role. Draping and respectful explanations protect dignity and reduce anxiety. Unnecessary exposure, unrelated observers, and loud discussion violate privacy. Question 24. At a pediatric visit, a patient in the exam room is involved when a chest lead is being placed during a 12-lead EKG during the visit. Where should V2 be positioned? Option A. Fifth intercostal space at the left midclavicular line. Option B. Right lower abdomen. Option C. Fourth intercostal space at the left sternal border. Option D. A fourth intercostal space at the right sternal border. The correct answer is option C. Fourth intercostal space at the left sternal border. V2 belongs at the fourth intercostal space on the left sternal border. Right sternal placement is V1. Fifth intercostal midclavicular placement is V4, and the right lower abdomen is a limb lead area. Question 25. During a skills check, the scenario states that an EKG tracing shows irregular spikes while the patient talks and moves for a patient with a routine complaint. Which action should the medical assistant take? Option A. Move electrodes randomly until spikes disappear. Option B. Ignore the artifact and file the tracing. Option C. Increase room noise so the patient relaxes. Option D. Ask the patient to relax, remain still, and avoid talking during the recording. The correct answer is option D. Ask the patient to relax, remain still, and avoid talking during the recording. Movement and muscle activity can create artifact that interferes with interpretation. Noise, random lead movement, or ignoring the artifact does not correct the signal problem. Question 26. After confirming the patient's identity, a patient asks what a 12-lead EKG records. Which response is accurate? Option A. It measures blood glucose through the skin. Option B. It injects dye into the coronary arteries. Option C. It records electrical activity of the heart from multiple views. Option D. It directly measures lung volume. The correct answer is option C. It records electrical activity of the heart from multiple views. A 12-lead EKG displays the heart's electrical activity from different lead perspectives. It is not a glucose test, pulmonary function test, or invasive dye study. Question 27. A medical assistant reviews a case where a patient reports new chest pain while an EKG is being recorded during clinical workflow. Which action should the medical assistant take? Option A. Tell the patient to drive home and rest. Option B. Finish filing old charts before reporting. Option C. Notify the provider immediately according to emergency protocol. Option D. Erase the tracing because pain changes results. The correct answer is option C. Notify the provider immediately according to emergency protocol. New chest pain can represent an urgent cardiac concern and should be escalated immediately. Delaying, advising the patient to drive, or deleting clinical information can endanger the patient. Question 28. During a skills check, The scenario states that a patient leaves a medication question by phone for a patient with a routine complaint. Which information should be documented? Option A. Only the caller's tone of voice. Option B. Date, time, caller identity, message details, and action taken. Option C. The assistant's lunch preference. Option D. No documentation unless the patient complains. The correct answer is option B. Date, time, caller identity, message details, and action taken. Complete telephone documentation creates a clear record of the request and response. Tone alone, irrelevant personal details, or no documentation can lead to missed care and poor continuity. Question 29. In a medical assistant certification review scenario, a patient is cold and shivering during an EKG. Which artifact is most likely? Option A. A guaranteed myocardial infarction. Option B. Muscle artifact that makes the tracing appear noisy. Option C. A blood pressure cuff leak. Option D. A normal calibration mark only. The correct answer is option B. Muscle artifact that makes the tracing appear noisy. Shivering creates muscle activity that can make the tracing noisy and difficult to interpret. It should not be assumed to be a heart attack, a cuff problem, or only a calibration mark. Question 30. Before a task that requires triaging urgent calls appropriately for a 48-year-old patient arriving for a lab appointment, which step best protects patient safety? Option A. Give a diagnosis over the phone to save time. Option B. Place every caller on hold until closing. Option C. Tell a caller with chest pain to wait for a routine opening next month. Option D. Follow the office triage protocol and alert. The correct answer is option C. Use draping and expose only the areas needed for electrode placement. Draping and limited exposure protect privacy while allowing accurate electrode placement. Open doors, unnecessary observers, and hallway comments violate dignity and confidentiality. Question 31. For a patient who appears anxious in an outpatient setting, a medication is about to be administered in the clinic for a patient who appears anxious. Which check is part of safe medication administration? Option A. Verify the right patient, medication, dose, route, time, and documentation. Option B. Give the dose if the medication name sounds familiar. Option C. Document before the patient receives the medication. Option D. Skip allergy review if the patient is a regular visitor. The correct answer is option A. Verify the right patient, medication, dose, route, time, and documentation. The medication rights reduce errors by confirming key elements before and after administration. Familiar names, early documentation, and skipped allergy review can create preventable medication mistakes. Question 32. While reviewing office protocol, a patient waiting for the provider is involved when an intramuscular injection is ordered in the deltoid site. Which action supports safety? Option A. Use the same site repeatedly without assessment. Option B. Identify the correct landmark and avoid injecting too low on the arm. Option C. Inject directly into the elbow crease. Option D. Choose the site through clothing. The correct answer is option B. Identify the correct landmark and avoid injecting too low on the arm. Correct landmarking helps place the medication in muscle and reduces risk of nerve or tissue injury. The elbow crease, injection through clothing, or repeated use without assessment are unsafe techniques. Question 33. A medical assistant reviews a case where a urine culture is ordered for a patient with possible infection during a quality control check. Which instruction is appropriate? Option A. Fill the container with water before collecting urine. Option B. Clean the area and collect a midstream specimen in a sterile container. Option C. Touch the inside of the lid to keep it nearby. Option D. Collect from the toilet bowl after voiding. The correct answer is option B. Clean the area and collect a midstream specimen in the sterile container. A clean catch midstream technique reduces contamination for culture results. Touching sterile surfaces, collecting from the toilet, or adding water can contaminate or dilute the specimen. Question 34. A provider asks for assistance because insulin is prescribed in units for a patient with limited mobility. Which equipment is appropriate for measuring it? Option A. A tuberculin syringe marked only in milliliters without conversion. Option B. A medicine cup for tablets. Option C. A household teaspoon. Option D. An insulin syringe calibrated in units. The correct answer is option D. An insulin syringe calibrated in units. Insulin syringes are specifically calibrated in units to match insulin dosing. Household spoons, unconverted milliliter markings, and tablet cups do not provide safe insulin measurement. Question 35. For a pediatric patient in an outpatient setting, a patient asks why pulse may be checked before taking a beta blocker. Which explanation is accurate? Option A. Beta blockers can lower heart rate and blood pressure. Option B. They are used only as antibiotics. Option C. They always raise blood glucose immediately. Option D. They make pulse checks unnecessary. The correct answer is option A. Beta blockers can lower heart rate and blood pressure. Beta blockers commonly reduce heart rate and blood pressure, making pulse assessment clinically relevant. They are not antibiotics, do not always raise glucose immediately, and do not eliminate the need for monitoring. Question 36. While reviewing office protocol, an older adult is involved when a patient taking furosemide asks why urination has increased while checking the chart. Which explanation is most accurate? Option A. Diuretics stop kidney filtration completely. Option B. Diuretics are used only for pain relief. Option C. Diuretics help the body remove excess fluid through urine. Option D. Diuretics are vaccines against infection. The correct answer is option C. Diuretics help the body remove excess fluid through urine. Furosemide is a diuretic that increases fluid and electrolyte excretion through the kidneys. It does not stop filtration, function as a vaccine, or serve only as an analgesic. Question 37. During a skills check, the scenario states that a patient develops hives, wheezing, and throat tightness after an injection for a patient waiting for the provider. Which emergency medication may be indicated by protocol? Option A. Routine multivitamin. Option B. Oral iron only. Option C. Epinephrine. Option D. Topical sunscreen. The correct answer is option C. Epinephrine. Epinephrine is the first-line emergency medication commonly used for anaphylaxis because it supports airway and circulation. Iron, sunscreen, and multivitamins do not treat acute allergic airway compromise. Question 38. When preparing safe patient care, a warm compress is ordered for a localized muscle strain. Which action supports safety? Option A. Place it over a medication patch. Option B. Apply maximum heat to speed healing. Option C. Use heat over numb skin without monitoring. Option D. Check temperature and skin condition before and during application. The correct answer is option D. Check temperature and skin condition before and during application. Heat therapy requires temperature checks and skin monitoring to prevent burns. Excessive heat, numb skin without monitoring, or use over patches can cause injury or alter medication absorption. Question 39. In a medical assistant certification review scenario, a patient asks whether to stop an antibiotic once symptoms improve during the visit. Which instruction is generally appropriate? Option A. Follow the prescribed course and contact the provider before stopping early. Option B. Stop immediately when feeling better every time. Option C. Save the rest for a family member. Option D. Double the next dose to finish faster. The correct answer is option A. Follow the prescribed course and contact the provider before stopping early. Antibiotics should be taken as prescribed unless the provider changes the plan, which helps treatment success and stewardship. Stopping early, sharing medication, or doubling doses can be unsafe and ineffective. Question 40. While following clinic policy, the medical assistant notes that an order is for 500 mg and the available tablets are 250 mg each for a patient with a routine complaint. How many tablets are needed? Option A. 0.5 tablet. Option B. 10 tablets. Option C. 4 tablets. Option D. 2 tablets. The correct answer is option D. 2 tablets. Dividing the ordered dose of 500 mg by 250 mg per tablet gives 2 tablets. The other amounts would provide too little or too much medication. Question 41. After confirming the patient's identity, a vaccine is administered in the clinic. Which detail should be documented? Option A. Only the patient's favorite pharmacy. Option B. A guess at the manufacturer if the label is missing. Option C. Vaccine name, lot number, expiration date, site, route, and patient response is required. Option D. The weather outside the clinic. The correct answer is option C. Vaccine name, lot number, expiration date, site, route, and patient response is required. Vaccine documentation supports traceability, safety monitoring, and legal requirements. Pharmacy preference, whether, and guest manufacturer details do not replace required vaccine records. Question 42. For a new patient in an outpatient setting, a provider describes a patient's heart rate as bradycardic during a high-yield exam review. What does this mean? Option A, high blood sugar. Option B, absent breathing. Option C, slower than normal heart rate. Option D, faster than normal heart rate. The correct answer is option C, slower than normal heart rate. Bradycardia means a slower than normal heart rate based on clinical context. Tachycardia, apnea, and hyperglycemia describe different findings. Question 43. During a follow-up visit, medical supplies have expiration dates for a patient waiting for the provider. Which inventory method reduces waste? Option A, ignore expiration dates if packaging looks clean. Option B, hide older supplies behind new boxes. Option C, use the newest supplies first every time. Option D, use first in, first out rotation while checking expiration dates. The correct answer is option D, use first in, first out rotation while checking expiration dates. First in, first out rotation helps older usable supplies get used before they expire. Newest first storage, hiding older stock, or ignoring dates increases waste and safety risk. Question 44. After confirming the patient's identity, a patient with COPD reports increased shortness of breath after reviewing the order. Which system is primarily involved? Option A, integumentary system only. Option B, skeletal system only. Option C, respiratory system. Option D, reproductive system only. The correct answer is option C, respiratory system. COPD is a chronic respiratory condition involving airflow limitation. Skin, reproductive, and skeletal systems may matter in healthcare but are not the primary system in COPD. Question 45. When preparing safe patient care, a patient asks what the kidneys do for a patient in the exam room. Which response is accurate? Option A, pump blood through arteries. Option B, filter waste from blood and help regulate fluid balance. Option C, exchange oxygen in the alveoli. Option D, produce bile for fat digestion. The correct answer is option B, filter waste from blood and help regulate fluid balance. The kidneys filter blood, form urine, and help regulate fluid and electrolyte balance. Bile production, gas exchange, and blood pumping are liver, lung, and heart functions. Question 46. During a skills lab scenario, a study question asks about bile production. Which organ is primarily responsible? Option A, bladder. Option B, appendix. Option C, the adrenal gland. Option D, liver. The correct answer is option D, liver. The liver produces bile, which helps with fat digestion after storage and release through the biliary system. The appendix, bladder, and adrenal gland have different roles. Question 47. At the front desk handoff, an anatomy diagram divides the body into left and right portions while maintaining privacy. Which plane is shown? Option A, transverse plane. Option B, frontal plane. Option C, sagittal plane. Option D, the oblique medication route. The correct answer is option C, sagittal plane. The sagittal plane divides the body into left and right portions. Transverse divides upper and lower. Frontal divides front and back. And oblique medication route is not an anatomical plane. Question 48. During a walk-in visit, a patient describes dysuria for a patient with limited mobility. What does this usually indicate? Option A, after meals. Option B, difficult or painful. Option C, without. Option D, normal. The correct answer is option B, difficult or painful. Dys often means difficult, painful, or abnormal, so dysuria is painful or difficult urination. Normal, without, and after meals are represented by different word parts. Question 49. In a medical assistant certification review scenario, a rash is described as proximal to the wrist after reviewing the order. What does proximal mean? Option A, on the back side only. Option B, farther from the trunk. Option C, toward the skin surface. Option D, closer to the trunk or point of attachment. The correct answer is option D, closer to the trunk or point of attachment. Proximal means closer to the trunk or the point where a limb attaches. Distal, posterior, and superficial refer to different anatomical directions. Question 50. In a medical assistant certification review scenario, a patient is lying flat on the back for an exam for a returning patient. Which position is this? Option A, Sims. Option B, prone. Option C, lithotomy. Option D, supine. The correct answer is option D, supine. Supine means lying face up on the back. Prone is face down, lithotomy uses stirrups, and Sims is a side-lying position. Question 51. In a medical assistant certification review scenario, a patient's insurance requires approval to see a specialist. Which document or process may be needed? Option A, medication lot sticker. Option B, inventory count sheet. Option C, autoclave log only. Option D, referral. The correct answer is option D, referral. A referral authorizes or documents the need for specialty care under many insurance plans. Inventory sheets, sterilization logs, and lot stickers do not authorize specialty visits. Question 52. During a certification-style scenario, an older adult is involved when a patient has low hemoglobin and complains of fatigue during a high-yield exam review. Which condition is being described? Option A, appendicitis. Option B, anemia. Option C, dermatophyte infection. Option D, hypertension. The correct answer is option B, anemia. Anemia involves reduced hemoglobin or red blood cell capacity and can cause fatigue or weakness. Appendicitis, hypertension, and fungal skin infection do not describe low hemoglobin. Question 53. While rooming a patient, a staff member asks for a patient's full chart to answer a simple billing question for a patient with diabetes. Which HIPAA principle applies? Option A, use only the minimum necessary information to complete the task. Option B, share the entire chart because staff are curious. Option C, post the details in the waiting room. Option D, send the chart to a friend for advice. The correct answer is option A. Use only the minimum necessary information to complete the task. The minimum necessary standard limits access and disclosure to what is needed for the job task. Curiosity, public posting, or sharing outside the care team violates privacy expectations. Question 54. During a clinical skills check, a pediatric patient is involved when an insurance plan must approve a medication before it is dispensed. What process is being requested? Option A, coinsurance posting. Option B, alphabetic indexing. Option C, waive scheduling. Option D, prior authorization. The correct answer is option D, prior authorization. Prior authorization is payer approval required before certain medications or services are covered. Coinsurance, scheduling style, and filing order are separate administrative concepts. Question 55. During an annual wellness visit, a patient receives a statement from insurance showing allowed charges and payments before documentation is completed. What is this document called? Option A, explanation of benefits. Option B, incident report. Option C, prescription label. Option D, advance directive. The correct answer is option A, explanation of benefits. An explanation of benefits summarizes how an insurance claim was processed and what may be owed. Advance directives, incident reports, and prescription labels serve different purposes. Question 56. When preparing safe patient care, a term contains the combining form CARDI/O for a patient with hypertension. Which body structure is referenced? Option A, heart. Option B, stomach. Option C, skin. Option D, kidney. The correct answer is option A, heart. CARDI/O refers to the heart and appears in terms such as cardiology and cardiogram. Kidney, stomach, and skin use different word parts. Question 57. During a skills check, the scenario states that a claim needs a code for the patient's diagnosis. Which code set is used? Option A, HCPCS Level 2 only. Option B, ICD-10-CM. Option C, CPT only. Option D, NDC only. The correct answer is option B, ICD-10-CM. ICD-10-CM codes describe diagnoses and reasons for encounters. CPT, HCPCS Level 2, and NDC identify procedures, supplies, or drug products rather than diagnoses. Question 58. A provider asks for assistance because a claim includes durable medical equipment supplied to a patient while preparing for provider review. Which code set may be used? Option A. The provider's lunch schedule. Option B. HCPCS Level 2. Option C. Only the patient's zip code. Option D. A pain rating scale. The correct answer is option B. HCPCS Level 2. HCPCS Level 2 codes are commonly used for supplies, equipment, and some services not fully described by CPT. Zip codes, schedules, and pain scales are not coding systems for durable medical equipment. Question 59. At a community health clinic, a provider marks diagnoses and services after the visit for billing for a patient waiting for the provider. Which document is often used? Option A. Electrode tab. Option B. Autoclave pouch. Option C. Super bill or encounter form. Option D. Suture package. The correct answer is option C. Super bill or encounter form. A super bill or encounter form captures visit services and diagnoses for billing workflow. Sterilization pouches, suture packages, and electrode tabs are clinical supplies rather than billing documents. Question 60. A medical assistant reviews a case where a patient reports burning during urination and urinary frequency while communicating with the care team. Which condition may be suspected? Option A. Urinary tract infection. Option B. Otitis externa. Option C. Sprained ankle only. Option D. Myopia. The correct answer is option A. Urinary tract infection. Burning with urination and frequency are common symptoms associated with urinary tract infection. Ear canal infection, nearsightedness, and ankle injury do not best explain urinary symptoms. Question 61. A medical assistant reviews a case where the provider blocks lunch, meetings, and procedure times before booking patients for a patient who appears anxious. Which scheduling method is being used? Option A. Sterile scheduling only. Option B. Matrix scheduling. Option C. Biohazard scheduling. Option D. A random scheduling. The correct answer is option B. Matrix scheduling. Matrix scheduling blocks unavailable or reserved times so appointments are not placed there. Random, biohazard, and sterile scheduling are not standard appointment scheduling methods. Question 62. After confirming the patient's identity, two patients are placed in the same appointment slot. What is this called? Option A. Downcoding only. Option B. Double booking. Option C. Closed filing. Option D. Capillary puncture. The correct answer is option B. Double booking. Double booking schedules more than one patient in the same time slot and should be used carefully according to policy. Capillary puncture, filing, and downcoding are unrelated terms. Question 63. In a medical assistant certification review scenario, medical supplies have expiration dates before documentation is completed. Which inventory method reduces waste? Option A. Use first in, first out rotation while checking expiration dates. Option B. Use the newest supplies first every time. Option C. Ignore expiration dates if packaging looks clean. Option D. Hide older supplies behind new boxes. The correct answer is option A. Use first in, first out rotation while checking expiration dates. First in, first out rotation helps older usable supplies get used before they expire. Newest first storage, hiding older stock, or ignoring dates increases waste and safety risk. Question 64. A medical assistant reviews a case where a patient leaves a medication question by phone for a patient asking for clarification. Which information should be documented? Option A. The assistant's lunch preference. Option B. No documentation unless the patient complains. Option C. Only the caller's tone of voice. Option D. Date, time, caller identity, message details, and action taken. The correct answer is option D. Date, time, caller identity, message details, and action taken. Complete telephone documentation creates a clear record of the request and response. Tone alone, irrelevant personal details, or no documentation can lead to missed care and poor continuity. Question 65. For a new patient in an outpatient setting, an exam table is cleaned between patients after routine use. Which term describes reducing many pathogens on a surface? Option A. Venipuncture. Option B. Apical measurement. Option C. Transcription. Option D. Disinfection. The correct answer is option D. Disinfection. Disinfection reduces many disease-causing organisms on surfaces and is appropriate for many non-critical items. Apical measurement, venipuncture, and transcription are unrelated clinical or administrative tasks. Question 66. For a new patient in an outpatient setting, a competent adult refuses a recommended injection while prioritizing patient safety. Which action is appropriate? Option A, hide the syringe in another medication. Option B, delete the order without telling anyone. Option C, force the injection because it was ordered. Option D, notify the provider and document the refusal according to policy. The correct answer is option D, notify the provider and document the refusal according to policy. Competent patients generally have the right to refuse care, and the refusal should be communicated and documented. Force, deception, or unauthorized deletion violates autonomy and safe practice. Question 67. During a routine office visit, a staff member fails to follow a safety policy and a patient is injured as a result for a teen patient. Which concept is involved? Option A, negligence. Option B, autoclaving. Option C, therapeutic communication only. Option D, coinsurance. The correct answer is option A, negligence. Negligence involves a breach of duty that contributes to harm. Sterilization, cost sharing, and communication skills are different concepts and do not describe the legal breach by themselves. Question 68. During a walk-in visit, a staff member needs to discuss lab results with a patient. Which location best protects confidentiality? Option A, a private area away from other patients. Option B, the crowded waiting room. Option C, the clinic's social media page. Option D, a public elevator. The correct answer is option A, a private area away from other patients. Private conversations protect the patient's health information from unnecessary disclosure. Waiting rooms, elevators, and social media are inappropriate places to discuss confidential results. Question 69. While assisting with patient care, a patient names someone to make healthcare decisions if the patient becomes unable while maintaining privacy. Which role is being assigned? Option A, collection agency. Option B, sterile processing technician. Option C, insurance coder. Option D, healthcare proxy or durable power of attorney for healthcare. The correct answer is option D, healthcare proxy or durable power of attorney for healthcare. A healthcare proxy or durable power of attorney for healthcare identifies a decision maker if the patient loses capacity. Coding, sterilization, and collections are unrelated administrative roles. Question 70. A provider asks for assistance because a patient pays a fixed amount at each office visit under the insurance plan for an older adult. Which term describes this payment? Option A, copayment. Option B, relative value unit. Option C, premium refund. Option D, deductible only. The correct answer is option A, copayment. A copayment is a fixed patient payment due for a covered service. A deductible, premium refund, and relative value unit describe other financial or coding concepts. Question 71. In a medical assistant certification review scenario, a medical assistant wants to learn more about a symptom timeline. Which prompt encourages a fuller answer? Option A, do not talk about the symptom. Option B, it started yesterday, right? Option C, you are fine now, correct? Option D, tell me when you first noticed the symptom and how it has changed. The correct answer is option D, tell me when you first noticed the symptom and how it has changed. Open-ended prompts let the patient provide a narrative and timeline in their own words. Leading or dismissive statements restrict the information and can bias the history. Question 72. A medical assistant reviews a case where a patient with limited English proficiency needs discharge teaching during a quality control check. Which approach is best? Option A, ask the young child to interpret sensitive information. Option B, speak louder in English only. Option C, skip teaching because interpretation takes time. Option D, use a qualified medical interpreter according to policy. The correct answer is option D, use a qualified medical interpreter according to policy. Qualified interpreters improve accuracy, confidentiality, and patient understanding. Children, louder speech, or skipped teaching can cause errors and ethical concerns. Question 73. At a pediatric visit, a patient offers an expensive gift in exchange for special treatment for a patient in the exam room. Which response is appropriate? Option A, post the gift online with patient details. Option B, accept the gift and move the patient ahead of others. Option C, promise special access for more gifts. Option D, follow office policy and maintain professional boundaries. The correct answer is option D, follow office policy and maintain professional boundaries. Professional boundaries protect fairness, trust, and ethical care. Accepting gifts for special treatment, promising favors, or posting patient details creates ethical and privacy problems. Question 74. During a skills check, the scenario states that a medical assistant acts to promote the patient's welfare. Which ethical principle is demonstrated? Option A, maleficence. Option B, beneficence. Option C, fraud. Option D, deposition. The correct answer is option B, beneficence. Beneficence means acting for the benefit and welfare of the patient. Maleficence, fraud, and deposition describe harm, deception, or legal testimony rather than doing good. Question 75. A provider asks for assistance because a patient uses a rescue inhaler during episodes of wheezing after noticing a potential safety concern. Which process is commonly involved in asthma? Option A, loss of tooth enamel only. Option B, excess bone growth in the femur. Option C, bronchoconstriction and airway inflammation. Option D, failure of the eardrum to vibrate. The correct answer is option C, bronchoconstriction and airway inflammation. Asthma commonly involves narrowed inflamed airways that can cause wheezing and shortness of breath. Bone growth, eardrum movement, and tooth enamel loss do not explain asthma symptoms. Question 76. A medical assistant reviews a case where an unconscious patient needs emergency care and no surrogate is available for a patient with diabetes. Which consent concept may apply? Option A, routine copayment consent. Option B, alphabetic consent. Option C, express written refusal. Option D, implied consent. The correct answer is option D, implied consent. Implied consent may apply in emergencies when a patient cannot consent and urgent care is necessary. Written refusal, payment consent, and alphabetic consent do not describe this emergency concept. Question 77. During a skills check, the scenario states that a patient in the waiting room reports crushing chest pain and sweating. Which action should the medical assistant take? Option A, tell the patient to drive home and sleep. Option B, activate the office emergency protocol and notify the provider immediately. Option C, offer billing forms before alerting anyone. Option D, ask the patient to wait until the next available routine slot. The correct answer is option B, activate the office emergency protocol and notify the provider immediately. Crushing chest pain with sweating may indicate a medical emergency and requires immediate escalation. Waiting, advising the patient to drive, or focusing on paperwork delays care. Question 78. When preparing safe patient care, a patient begins having a seizure in the exam room after noticing a potential safety concern. Which action is appropriate? Option A, put fingers in the patient's mouth. Option B, offer food during the seizure. Option C, hold the patient down forcefully. Option D, protect the patient from injury and do not restrain movements. The correct answer is option D, protect the patient from injury and do not restrain movements. Seizure first aid focuses on safety, protecting the head, and allowing the seizure to pass without restraint. Placing objects in the mouth, forceful restraint, or giving food during a seizure can injure the patient. Question 79. A medical assistant reviews a case where a patient develops wheezing and facial swelling after a medication for an adult patient. Which response is appropriate? Option A, offer a glass of water only. Option B, activate emergency protocol and prepare to assist with ordered epinephrine. Option C, schedule a routine follow-up in 6 months. Option D, tell the patient to ignore throat symptoms. The correct answer is option B, activate emergency protocol and prepare to assist with ordered epinephrine. Wheezing and facial swelling after medication can indicate anaphylaxis, requiring rapid emergency response. Routine scheduling, ignoring airway symptoms, or offering water alone delays potentially life-saving care. Question 80. During a walk-in visit, a pediatric patient is involved when a used needle has just been removed from a syringe after an injection. Which action is safest? Option A, drop it in a regular trash can. Option B, place the sharp immediately into an approved sharps container. Option C, carry it uncovered to the front desk. Option D, recap it using 2 hands before disposal. The correct answer is option B. Place the sharp immediately into an approved sharps container. Used sharps should go directly into a puncture-resistant sharps container to prevent injury and exposure. Carrying, recapping with 2 hands, or using regular trash creates avoidable needle stick risk. Question 81. When preparing safe patient care, a patient suddenly has facial drooping and arm weakness while preparing for provider review. Which emergency condition should be suspected? Option A, seasonal allergies only. Option B, stroke. Option C, routine nearsightedness. Option D, simple paperwork fatigue. The correct answer is option B, stroke. Facial drooping and arm weakness are warning signs captured by FAST for possible stroke. Allergies, vision issues, and paperwork fatigue do not match sudden focal neurologic deficits. Question 82. When preparing safe patient care, adult CPR is started according to current basic life support guidance for a patient scheduled for a procedure. Which compression rate is commonly taught? Option A, 250 to 300 compressions per minute. Option B, 100 to 120 compressions per minute. Option C, 10 to 20 compressions per minute. Option D, 1 compression every 5 minutes. The correct answer is option B, 100 to 120 compressions per minute. Adult CPR training commonly teaches a compression rate of 100 to 120 per minute. Very slow, extremely fast, or occasional compressions do not provide effective circulation support. Question 83. While following clinic policy, the medical assistant notes that a conscious adult cannot speak or cough effectively while choking. Which first aid action is commonly used? Option A, tell the patient to lie flat and sleep. Option B, insert a blind finger sweep. Option C, offer a large meal. Option D, abdominal thrusts according to training. The correct answer is option D, abdominal thrusts according to training. Severe airway obstruction in a conscious adult is commonly treated with abdominal thrusts by trained responders. Food, lying down, or blind finger sweeps can worsen obstruction or injury. Question 84. For a teen patient in an outpatient setting, a patient falls in the hallway and says their hip hurts after confirming office policy. Which action is appropriate? Option A, tell the patient to walk it off. Option B, keep the patient still, call for help, and follow incident protocol. Option C, lift the patient quickly without assessment. Option D, delete the event if no one saw it. The correct answer is option B, keep the patient still, call for help, and follow incident protocol. After a fall with pain, the patient should not be moved unnecessarily until assessed and help arrives. Rapid lifting, dismissing the injury, or hiding the event can worsen harm and violate reporting procedures. Question 85. When preparing safe patient care, an outside attorney requests a copy of a patient's medical record for a pediatric patient. Which action is generally required before release? Option A, send the record because the attorney sounds official. Option B, give only verbal gossip about the visit. Option C, post the record in the portal without checking identity. Option D, obtain a valid authorization or follow a permitted legal process. The correct answer is option D, obtain a valid authorization or follow a permitted legal process. Medical records generally require patient authorization or a valid legal basis before disclosure. Official-sounding requests, unchecked portal release, and informal gossip violate confidentiality. Question 86. When preparing safe patient care, a provider asks the medical assistant to prepare for suture removal. Which supply is commonly needed? Option A, a urine culture cup only. Option B, a blood pressure cuff only. Option C, sterile suture removal scissors or a sterile blade with forceps according to policy. Option D, a meal tray. The correct answer is option C, sterile suture removal scissors or a sterile blade with forceps according to policy. Suture removal uses appropriate sterile instruments and infection control technique. A cuff, urine cup, or meal tray does not remove sutures safely. Question 87. For a patient who appears anxious in an outpatient setting, a patient has a small foreign material exposure in the eye during a realistic certification question. Which action is appropriate before irrigation? Option A, ignore contact lenses and begin forcefully. Option B, apply random medication drops without order. Option C, check the order or protocol and use appropriate solution and protection. Option D, use a dry cotton swab across the cornea. The correct answer is option C. Check the order or protocol and use appropriate solution and protection. Eye irrigation should follow protocol with correct solution and care to prevent injury. Dry swabbing, unadhered medication, or forceful technique can damage the eye. Question 88. During a skills check, the scenario states that a patient is using a nebulizer treatment in the office for a patient asking for clarification. Which instruction is appropriate? Option A, turn the machine off whenever mist appears. Option B, drink the medication from the cup. Option C, share the mouthpiece with another patient. Option D, breathe normally through the mouthpiece or mask as directed until treatment is complete. The correct answer is option D. Breathe normally through the mouthpiece or mask as directed until treatment is complete. Nebulizers convert medication into mist for inhalation, so breathing through the device as directed is needed. Drinking medication, stopping at the start, or sharing equipment is unsafe and ineffective. Question 89. After confirming the patient's identity, a weak patient needs help stepping onto the scale. Which action supports safety? Option A, pull the patient quickly by one arm. Option B, use proper body mechanics and assistive devices according to the patient's needs. Option C, leave the patient unattended on the scale. Option D, ask another patient to help lift. The correct answer is option B. Use proper body mechanics and assistive devices according to the patient's needs. Safe transfer assistance uses body mechanics, assessment, and appropriate devices to prevent falls. Pulling, leaving the patient unattended, or asking another patient to lift creates safety risk. Question 90. When preparing safe patient care, instruments are removed from the autoclave after a cycle during a high-yield exam review. Which finding supports that the sterilization process should be reviewed before use? Option A. The chemical indicator has not changed as expected. Option B. The instrument pack is labeled with the date. Option C. The package is dry and intact. Option D. The load has a completed log entry. The correct answer is option A. The chemical indicator has not changed as expected. A failed chemical indicator suggests the sterilization conditions may not have been met and the load should not be used until evaluated. Dry packaging, completed logs, and date labeling are expected quality control elements rather than failure signs. Question 91. During a skills check, the scenario states that a cold pack is applied for a minor injury as ordered for a new patient. Which safety instruction is important? Option A, place a barrier between the cold pack and skin and monitor the area. Option B, apply ice directly until the skin turns white. Option C, use heat at the same time on the same site. Option D, leave it on for several hours unattended. The correct answer is option A. Place a barrier between the cold pack and skin and monitor the area. A barrier and monitoring reduce the risk of tissue injury from cold exposure. Direct prolonged ice, unattended use, or combining heat and cold inappropriately can harm the skin. Question 92. After confirming the patient's identity, a blood pressure reading is being prepared for an adult with a large upper arm. Which action supports the most accurate result? Option A, place the cuff over the sleeve for comfort. Option B, select a cuff with a bladder size appropriate for the arm circumference. Option C, deflate the cuff as rapidly as possible. Option D, use the smallest cuff to keep it snug. The correct answer is option B. Select a cuff with a bladder size appropriate for the arm circumference. Correct cuff size keeps the pressure reading closer to the patient's true blood pressure because an undersized cuff can falsely elevate the value. Measuring over clothing, choosing equipment for convenience, or deflating too quickly can distort the reading and lead to poor clinical decisions. Question 93. During a morning clinic session, a patient scheduled for a procedure is involved when a radial pulse feels uneven during a rooming assessment after the patient asks a follow-up question. Which measurement is most appropriate to obtain next? Option A, estimate the pulse for 15 seconds and multiply by 4. Option B, use only the patient's reported usual heart rate. Option C, skip the pulse and document unable to assess. Option D, count the apical pulse for a full minute. The correct answer is option D, count the apical pulse for a full minute. An irregular rhythm should be assessed for a full minute at the apical site for a more accurate rate. Short estimates, omitted measurements, or patient-reported values do not provide dependable clinical information. Question 94. A medical assistant reviews a case where a patient drank hot coffee immediately before an oral temperature is planned for a patient scheduled for a procedure. Which action should the medical assistant take? Option A, record the temperature immediately because coffee has no effect. Option B, wait before taking the oral temperature or use an approved alternate route. Option C, ask the patient to sip cold water to balance the reading. Option D, use the same probe cover for a repeat reading. The correct answer is option B, wait before taking the oral temperature or use an approved alternate route. Hot or cold intake can temporarily alter oral temperature readings, so waiting or using an approved alternate route improves accuracy. Immediate measurement, reused covers, or trying to offset the effect with another drink can create unreliable data and poor infection control. Question 95. A provider asks for assistance because a radial pulse feels uneven during a rooming assessment. Which measurement is most appropriate to obtain next? Option A, estimate the pulse for 15 seconds and multiply by 4. Option B, count the apical pulse for a full minute. Option C, use only the patient's reported usual heart rate. Option D, skip the pulse and document unable to assess. The correct answer is option B, count the apical pulse for a full minute. An irregular rhythm should be assessed for a full minute at the apical site for a more accurate rate. Short estimates, omitted measurements, or patient-reported values do not provide dependable clinical information. Question 96. In a medical assistant certification review scenario, an adult patient is asked to rate pain during intake during clinical workflow. Which documentation is most appropriate? Option A, pain is bad because the patient looks uncomfortable. Option B, patient probably exaggerates pain. Option C, no pain score needed because vital signs are normal. Option D, pain level of 7 on a 0 to 10 scale with location and quality. The correct answer is option D, pain level of 7 on a 0 to 10 scale with location and quality. Pain is subjective and should be documented using the patient's stated rating along with useful details such as location and quality. Judgments, assumptions, and ignoring pain because other vital signs are normal fail to capture the patient's report. Question 97. A provider asks for assistance because a patient says, "I feel pressure in my chest after climbing stairs," for a new patient. How should the information be documented? Option A, record the statement as subjective data in the patient's own words when possible. Option B, document it as a confirmed diagnosis of angina. Option C, change the wording to make it sound less serious. Option D, leave it out unless the provider hears it directly. The correct answer is option A. Record the statement as subjective data in the patient's own words when possible. The patient's reported symptom is subjective data and should be documented accurately for the provider's evaluation. Medical assistants should not diagnose, omit relevant symptoms, or soften documentation in a way that changes the meaning. Question 98. During a skills check, the scenario states that a new patient begins explaining the main reason for the visit. Which item should be captured as the chief concern? Option A, the insurance plan name. Option B, the patient's primary reason for seeking care today. Option C, the brand of exam table used. Option D, the clinic's appointment schedule. The correct answer is option B, the patient's primary reason for seeking care today. The chief concern identifies why the patient came for care and guides the visit workflow. Insurance details, equipment information, and the clinic schedule do not describe the patient's presenting problem. Question 99. A medical assistant reviews a case where a blood specimen label is about to be placed on a tube while communicating with the care team. Which action best prevents patient identification errors? Option A, verify two identifiers such as full name and date of birth before labeling. Option B, ask another patient to confirm the name. Option C, label the tube after returning to the desk. Option D, use the room number as the only identifier. The correct answer is option A. Verify two identifiers such as full name and date of birth before labeling. Two identifiers reduce the risk of assigning results to the wrong patient and should be checked before specimen labeling. Room numbers, delayed labeling, and unrelated confirmation are unsafe because they can lead to misidentification. Question 100. A medical assistant reviews a case where a provider asks the medical assistant to prepare for suture removal for a pediatric patient. Which supply is commonly needed? Option A. A blood pressure cuff only. Option B. A urine culture cup only. Option C. Sterile suture removal scissors or a sterile blade with forceps according to policy. Option D. A meal tray. The correct answer is option C. Sterile suture removal scissors or a sterile blade with forceps according to policy. Suture removal uses appropriate sterile instruments and infection control technique. A cuff, urine cup, or meal tray does not remove sutures safely.